Hi everyone, sorry I'm late. 10:01. Dr. Rob Kiltz, how you doing? A little bit of the pineapple and a little body by bacon. And good morning. Good morning, Dr. Rob Kiltz, CNY Fertility live for about 60 minutes-ish. Going to be chit-chatting, answering questions, listening and learning from you guys as we're all working together. I am Honey. Hey, Del Banks, how you doing? Dial Hale, hello. Christine, yes. Shell, hello. Kristen Ann, hi. Good morning to everyone. Another beautiful day in the universe. We start the day with lots of love, faith, kindness, and gratitude. NM, Mahaz, hello, Hans. Andrea, good morning. Donk, good morning to everyone. Houston, Jesney, India, my brain, and you know, it's this dyslexic old thinking now to the new thinking of taking time. Yes, Shalika, hello. Alicia, Danica, hello. Heather, Nahid, Samantha, good morning. 4-week HCG, 375. Yes, that's good. Mrs. Kara, let's see. Himman, oh boy, good morning. Clomid increased chance for twins. Yes, it does. Clomid and letrozole both increase the chance of multiples. It's usually about 4 to 10%. But like anything else, if you do an intercourse IUI, oh, hang on 1 second. Good morning, sweetie. Can I call you back? Okay, bye. All right. Something's very important to answer, Miss T. All right. But again, yes, Clomid, letrozole, injectables certainly can increase the chances. So that's why we recommend ultrasounds to take a look to see where you're at. If you're doing an intercourse IUI cycle, certainly some people even do Clomid and letrozole with IVF, and that obviously getting more is good. Good morning, Justine. How are you? Gina Smith, hello. Mocha Taylor, good morning. All right, let's see what we got going on here. Love the questions. A lot happening. Colorado. I'm technically going to announce it later this week, but it's looked like rocking and rolling probably in July. Tamara, hello. Good morning. Is the Healing Arts Center open in Syracuse? Yes, it's opening this week. Working to bring it a whole new level. Really excited to have everyone back. But again, it's not perfect. It's going to take a little time for everyone to kind of relax in the process and not get too stressed and strained. We're still doing our social distancing as much as we can, masks, but recognize washing hands. All of us have to protect ourselves. Thanks to Donald Amuha yesterday for handling our acupuncture in Syracuse for transfers, but everyone's going to be coming back. All right. Monica Beavis, Facebook support, the IVF Journey. I'm doing a live at 11:30. That's the IVF Journey at 11:30. I'm going to do a live and answer some questions in the support group. So really excited to be doing that, by the way. Pros and cons of using prednisone for transfer. Hi, Heather. How you doing? So the idea is that inflammation is really a global cause of all disease for everyone. And adding a steroid may be helpful to reduce some of that inflammation, especially in the metabolic disorders, but I think it's globally in everyone. We tend to use either prednisone, dexamethasone, or nothing in some cases, but 2.5 to 5 milligrams of the prednisone once or twice a day, even up to 10 twice a day, if we're being more aggressive, that I think can be very helpful for many. Again, it's a global approach. My belief is that all of us have some inflammation in our bodies, and it does help. Hey, Cheryl, how you doing? I tried calling. We'll connect a little later today, by the way. Thanks. And this is one of our CNY, and it's all about pineapples because that's the queen fruit of reproduction. And so it's kind of fun. And whether you're wearing it like this or wearing it like this or wearing it like this or you're wearing it like this, we're all really working to kind of bring some energy to the group, and all of us praying, meditating, visualizing success on this journey for everyone. Hey, Grace, Jacinta. So I typically recommend, where you're doing fresh or frozen, IUI or IVF, even if you're doing some natural cycles, for some, a little bit of steroid may be helpful along with an antibiotic, low-dose naltrexone, CBD, and guess what? Kiltz is keto. And don't forget Emmerich Keto, Greg and Maria, and we're coming out with a new book pretty soon. We just have on Amazon The Fertile Feast, if you haven't checked that out, or Dr. Kiltz's Keto Lifestyle. Check that out also, by the way. Hey, Dottie Drew, how you doing? Let's see, Nephew Will kind of helped get these all rocking and rolling. I think we sell them online, but wherever you're getting your pineapple stuff or your got knocked up in one way or another from CNY or whatever we're doing, that we want to share the love, the faith, and the energy that we're all coming together and helping. When should someone take the leap to do IVF after the other fertility treatments like IUI? Failed one IUI, but 5 cycles of letrozole with timed intercourse. Kayla, Barry, that's kind of up to you. It's all individualized approach, anywhere between 3 and 6 IUIs, but no IUIs and moving right to IVF is reasonable also. I think that, remember, it's a global approach to health and wellness for men and women. Egg and the sperm are both important. Remember, if the sperm looks good, we blame the woman. You got to keep in mind that whatever looks normal may still be abnormal and not functioning. But I would say IUI, 3 to 6 cycles may be reasonable, but you got to balance and measure for you the cost physically, financially, and guess what? Emotionally. It's the emotions of the ocean that drive us and push us to distress and stress. That's why I recommend meditation, prayer, visualization. I put out a little Coffee with Kiltz this morning on my Facebook. Please join and listen and learn and share your ideas how we could all do better every day. But I would say, if you have a lower AMH, if you're over 35, maybe move a little bit quicker. But we've seen so many in the 40s that they say, okay, I'm going to take care of this thing, find all the natural things to do, and make it better for myself. And so sometimes I just want to check out one other. My brother Ray sent me a nice one with Fertility Mindset with Roseanne Austin. And if you check out Roseanne Austin's stuff, it's a mindset. And if you look back 15 years, almost 20 years for me, my Mind, Body, Smile, I mostly talk about it's the mindset. And the more we can do that, the better. Nisha, hi. Hysteroscopy and DNC effective to treat chronic endometritis. A hysteroscopy DNC may be enough to treat chronic endometritis, but I do recommend a 2 to 4 week course of antifungal, antiviral, and antibiotic. I know it seems like a little too much, but I've seen it work and help a lot. I often recommend a laparoscopy, hysteroscopy combined to look intraperitoneally for adhesions, endometriosis, scar tissue, or just evidence of chronic inflammation. That might be the time to think about, again, when you do the hysteroscopy, do the DNC, add the antibiotics, and PRP, low-dose naltrexone, CBD. And if you go to my website, drkiltz.com, or the CNY Fertility website, or on Amazon, Dr. Kiltz Keto is on there. We are working to get the family building guide also. Hey, Beth from Kansas, Chilox, how you doing? Neupogen and Plaquenil. All right, how do these help? So basically, remember, what's the cause of infertility? What's the cause of cancer, heart disease, ALS, MS? Every disease is caused by inflammation. 5 causes of inflammation: sugar, all from plants basically, plant antigens and other microorganisms that get into our body diminish, destroy, or damage our internal environment. The chemicals made by those other organisms, remember plants are organisms, so are bugs and many other things, and then the fermentation in our gut. So Plaquenil and Neupogen seem to be modulators of this chronic inflammation. I'm just sort of always looking around and saying, okay, what are other areas of medicine using for inflammation? And Plaquenil and hydrochloroquine have been around for thousands of years, initially as an herbal treatment, but you know the world was traveling to find all this herbal medicine, spices. And if you haven't read about the Spice Islands, you got to read about the history of us human beings and constantly in search of the magic pill. If you haven't watched The Magic Pill, I highly recommend it. But the Neupogen and the Plaquenil can be used to modulate and modify our internal inflammatory environment. How it works, I don't know that answer. But we do know that there are some benefits to all these things. And I'm always looking around at what are other people doing for other diseases and damage to the Ferrari, the lioness, and the Lion King plan. I know it seems crazy, but it does work. And again, the modification, and so if you go to our website, seemyfertility.com, look at the patient portal, then download the simple guide to improving your fertility. We have a whole list of 20 things you could do. Remember, sometimes it's the naturopathic way to find the health and wellness. It's first built in the mind, in the mouth, to master ways of improving your health and wellness, by the way. All right, let's see. How's everyone doing? Happy Sunday to everyone, by the way. This is kind of my day of rest and faith and prayer and patience. We all need to find that, and typically we don't do retrievals or transfers on Sundays. I do my live, but this is part of the joy that I find in life, is connecting with you guys in ways. Can I do PRP for ovaries without doing an egg retrieval? Sarah JKP99, yes. You can do intraovarian. I recommend also intrauterine, which spills out into the peritoneal cavity if you have open tube or tubes. I think a lot of that is very, very valuable, by the way. And don't forget acupuncture, massage, some herbal directives from an experienced person on the herbs that you're consuming can be very helpful, by the way. Christine Marie, how you doing? And remember, it's all a manifestation within the mind that matters most. Remember, life and everything about your life is a dream, right? Have faith in the dream. Is it possible DHEA raises AMH 50 micrograms a day? Mine is low, 0.79, 35. Happy birthday, by the way. And so I am doing IVF next cycle, no matter what, but trying to get everything up and good. So that's absolutely the trick of this process. It's what can you do to change this thing? I've seen AMHs go up, FSHs drop down, fertility happen naturally by listening and learning to Kiltz's keto concepts. Now, I'm taking all these ideas from many others, trying to compile it into a simple, streamlined idea, which is basically the Ferrari, you and I, or pick whatever masterful thing you believe, like a pineapple, the fruit of life, the queen fruit of life. It's just, remember, it's a headdress that basically says, hey, I'm really great, but remember, you already are. But DHEA, low-dose naltrexone, CBD, if you can consume it, and Kiltz's keto is 1 meal a day at night. It's high fat, low to no carbs, lowish amino acids, protein. Again, our concepts and understanding are actually opposite. And if you're a vegan vegetarian, you got to add the fat, all right? Cook the carbs well. It's still 1 meal a day, and get off of the treadmill. It really helps. AMH of 5.3, it's okay. This high AMH, it's better to have an AMH of 5 than 0.5. And so the AMH doesn't say I have PCOS, by the way. Polycystic ovaries are quite normal and natural in younger women. And I've seen younger women have diminished ovarian reserve due to chronic inflammation as a child, which affects you as an adolescent, which affects your reproductive potential for men and women all day long, by the way. How's everyone doing? Thank you for joining me. A little bit of water, not too much. Don't go too crazy on this. Atlanta right now is next year likely for retrievals and transfers. I'm not promising right yet, but I'm first getting Buffalo up and rocking and rolling. We're getting Dr. Chang, Dr. D'Souza, and everyone working together to foster and master getting all of this done. All right, let's see. Dole Whip, how you doing? I am likely taking this Wednesday, Thursday, Friday, Saturday, and Sunday off from being in Syracuse. I've got a great team. I'm going to continue to be chatting with some people over these few days, but I just needed a little bit of time to spend with Miss T and really regroup and regenerate, but continue the conversation. IVF be successful the first time when IVF is need due to sperm motility. Absolutely. I am honey German. So, IVF can work the first time, the second time, the third time, the fourth time. I just had someone at 44, the 10th time. Why it takes so many times, I don't know. But you just got to jump into it, dive into it, head first. Remember, the head is the mind. If you lead with the mind as the master with love and generous thinking. Really important, by the way. What should I do? Low testosterone, low DHEA. Allie, again, it's follow the general lifestyle plan of Dr. Kiltz's keto. Again, it's maybe if you got an elevated, if your AMH is 5.3, the DHEA may not be helpful, but the human growth hormone, LDN and CBD and keto may be. And this is where acupuncture, massage, and get off the treadmill and slow it down, by the way. Let's see. Mesa Blue, how you doing? Mo Bob 12, hello. Nat M Markart, hello. Star 4012. Let's see, do I recommend? I'm sorry, sometimes I'm scrolling on these things and it doesn't go quite as fast. Thought of RIF for 5 well-graded PGS normal embryos. Have done ERA and receptive diagnosis, 2 months of Lupron, but embryos still aren't sticking. Laparoscopy, hysteroscopy. This is where the antibiotic therapy may come in, and Kiltz's keto may be really valuable. And sometimes simplify it to a letrozole trigger transfer and minimal meds, maybe a level 1 immune at best. And sometimes a gestational carrier may be needed because we can't always see or know what the cause is, but we are quite often mystified why it doesn't work, and we don't really know. But don't forget the level 4 immune, IVIG, Humira, and LIT, Markham Fertility for leukocyte immunotransfusion, and or Nogales, Mexico. It's all opening up, by the way. It's all shifting and changing. First, a faith, trust, and baby dust. Absolutely. We all need to remember faith is thinking. And it's faithful in a belief that you will get exactly what you desire or better, or that you already have it. That's the really challenging way to think in life. But we go to the worry, fear quite often too fast, and that's the fight or flight. So it takes a lot of time and energy to calm the mind in order for cortisol and epinephrine to go like this and serotonin, oxytocin to go like that. It really changes things tremendously. HCG 28, progesterone only 13, 2 weeks after IUI should increase endometrium 3 times a day. technically, those aren't bad numbers. 10 or above for a progesterone is good, but it's not harmful if you add a little bit more endometrium. And don't forget, Kiltz's keto is great for pregnancy and beyond, for all our lives and beyond. Prescribed hydrochloroquine, when does it come into play? I just had my retrieval. I think the hydrochloroquine is a good one for transfer. If you're going to do a fresh, start it right away. But it may be that we should be thinking of these things earlier. Plaquenil, the low-dose naltrexone CBD, keto for sure, but it's 200 milligrams once or twice a day, but you really have to make sure you're getting the instructions, not for me over this group speak, but really individually. But if you're going to do a fresh transfer, go ahead and start it with your progesterone. I think it's really helpful, by the way. Megan, Nisha, Nadine, how you doing? PRP and Intra Lipids use. I'm trying to decide which ones. PRP and Intra Lipids are both good. Sometimes there's too many things and we get overwhelmed and we're like running around and we're like, what do I do? Remember the blanket, cozy and comfortable. That's what we're working on every day. Every day. So the level 2 is basically intralipids, Lovenox, the antihistamine, progesterone, antibiotics, and a low-dose steroid. The level 3 adds but the PRP really can be added at any level: intrauterine PRP, intrauterine HCG, and weekly intralipids. All of those can work really nicely, by the way. So when do you do them? Jump into them and ask about them. And don't forget embryo glue. We offer it, but you got to ask about it. We may be globally adding it to everyone, but I didn't want to add the cost to everyone if you don't want to use it, and whether or not it's the thing, I can't say for sure, but we offer them all, by the way. 41 AMH 0.61, planning to prep for a few IUIs on the way to IVF. Found out my insurance will cover IVF in full. As of July, would I recommend just prep, go straight to IVF? Ziegler has me on HGH, DHEA, along with other supplements, CoQ10, omegas, ED, and prenatals. Absolutely. But you've got to decide, hey, I want to do IUI, I want to do IVF. IVF tends to be, I think, a higher probability, but don't let go of the purpose of pregnancy on natural, by the way. Again, I'm going to be on Monica Beavis' Facebook support group, the IVF Journey, at 11:30 today, answering more questions, maybe talking a little bit more about the emotional journey and how we can tame the mind as much as we can work to tame the body, but it always starts in the mind first. And also check out my books on the fertile secret, also Amazon.com, and my daily inspiration, and that's the practice we all must be putting into our lives every day. Amy D. Margolis, how are you guys doing? To a T, and it does work 4 kids later. Isn't it amazing? And sometimes I've seen so many do the struggle of the fertility stuff and then say, we're done with that shit. And then suddenly it's like boom, 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 pregnant delivery, pregnant delivery, pregnant delivery, because do not lose faith in the possibility it can happen naturally for you, even though you thought, no way. Now, again, blocked tubes, no sperm, different story, but who knows? The master of the universe is that guy, gal up there, which is technically right in here. Do not give up. So intralipids, well, how or why do they work? Technically, I don't really know, but there is a lot of evidence that consuming fats orally or intravenously reduces inflammation. We don't eat fat. Fried foods are not fatty, by the way. You don't cook fat in fat. You cook carbs or protein in fat. It's like boiling at a higher temperature. Most of it does not stick inside the food you're cooking. So basically, we don't eat a fatty diet. We eat a low fat, high carb, high protein diet in all of this. So by consuming fats, either keto, Remember, keto is a 70 to 80% fat diet technically, with about 20 to 30% protein or carb mixture. And paleo has a little bit more carbs, still a high fat diet. Standard diets in general, Mediterranean is high carb, lower fat. And a vegan vegetarian in general, it's a high carb, low protein, low fat diet. But if you could manage to add fat, there's evidence that eating fat or intravenous intralipids reduces inflammation, which is the cause of every single disease, and infertility, repetitive losses, failed implantation is all, guess what? Inflammation, which again doesn't make sense up to how I was trained. But the one thing, the more and more I learn, I do all of the journeying of reading and recognizing that what we have been taught is mostly wrong, which again doesn't make sense. Just at a fresh that failed, we'll be doing an FET, PCOS, anything that could recommend add. So sometimes we always forget about laparoscopy, ovarian drilling, which I call ovarian acupuncture. It may help reduce the stress and the inflammation in the ovarian environment. But again, laparoscopy, hysteroscopy, DNC, an immune protocol, this is where adding either metformin 500 or ovasitol, inositol can be helpful. And look at the full immune protocol can be very helpful. But some people, the frozen does better than fresh does better than frozen. It's not like an all or none. It's individualized, and that's a lot of what we're all putting together is how can we individualize this journey to understand how to better create the success. But it really is in the doing, not in the stressing and wondering and worrying. It's in what can I do this time? And it may be simply do it again that will get you what you desire. But if you do it again and again and again and again the same way, and it's not changing or improving, then that's the time to switch it up. If you haven't read Mind is a Master by James Allen, or the highly recommended Success Principles by Jack Canfield, really helps, by the way. So again, PRP, HCG washes, intralipids, Lovenox, Plaquenil, prednisone, Neupogen. The list is too long, but don't stop. But asking these questions, and go to our magazines. You could download the Keto Magazine and the Family Building Guide on our website, drkiltz.com or cnyfertility.com, to really get some good ideas and listen and learn to the naturopaths, the chiropractors, the acupuncturists, to other fertility docs. It isn't, if IVF isn't working, it might be that there's still bad egg, bad sperm, bad environment, and we need to do some things to change it up, by the way. I don't think CMV status matters when it comes to picking sperm donors, in my opinion. We're not screening everyone for CMV status who are trying naturally. So I personally think we're overdoing it on that one. Individualized opinion, lots of opinions. Who's right? I don't know the answer. You've got to decide for yourself in this, unfortunately, recognizing that medicine is really a compilation of opinions, not of actual strict data that's right or wrong. It really is, you got to master it and look yourself. All right, let's see here. Motivation 4012, good morning. IUI, if there is a test done but no motile sperm. Well, technically you could do that, but you're putting non-motile sperm in an environment that the egg might run into the sperm. The sperm and egg might be able to get together without it being motile, but it's a very low probability. So that's where motile or non-motile sperm for injection into the eggs is the way to go. Whether you're doing a PESA, TESA, fresh or frozen thawed sample, all of those things may work in the process. Tarika, how you doing? Dottie Drew, hello again. Denise, hi. PRP really does work. LDN too. Thanks for everyone's comments. And I look towards you guys to learn the answer. And we're all a family village globally. And when we can all recognize that and see that, we can come together and learn from each other. When we learn to have love and kindness and generosity and faith for everyone, we lead with that, we learn with that, and we step back and we listen twice as much as we speak. I know, I sometimes need to zip it up. All right. Scrolling up and down. All right. Everyone doing good today? We're all learning together. Age limit, can women who have never been pregnant be a gestational carrier? Yes, you can. What's your uterus like, and how can we help improve your health and wellness to improve that environment for that beautiful, beautiful embryo growing intrauterine? Injectable IUI more effective than the letrozole IUI? Actually, yes. Let's see. Marlana, hello, Olivo. So natural cycle intercourse IUI or IVF usually is going to get one released egg, maybe two, rarely. Letrozole or Clomid with a trigger shot might be one or two. It might be 3 to 5. Most commonly 1 or 2, by the way. By adding the injectables, now you're hitting the ovaries harder. You're going to increase from 1 or 2 to 3 to 8 to 10 to 20 potentially. So you got to be really more careful. But it depends on your age, your AMH, your ovarian function. So I think, and depends on the dosing you're using. We do a lot of letrozole or Clomid, mostly letrozole with an injectable cycle, which is going to give you maybe 2 to 5 to 10 eggs, which is better for IVF. But for those that have that are in the late 30s and 40s, that's a good protocol that may still increase your odds, but you've got to still be careful about multiple pregnancies, even in the low to mid 40s, by the way. BTW, God bless you guys, I love you. LH surge be high, thyroid level high, have impact on egg quality. The LH rise or surge may cause ovulation or premature rise in progesterone, but there are a lot of women that have a chronically elevated LH and it doesn't seem to matter very much. This is where cetrotide, ganirelix, or Lupron to suppress ovulation may come in if you're on gonadotropins. But if you're a natural cycle or doing letrozole or Clomid and you add ganirelix, cetrotide, or Lupron, you'll suppress the development of the follicles, so that's not so good. But it may be, for those with metabolic syndrome, chronically elevated LH, there may be elevated androgens, which may adversely affect the egg quality. But I think a lot of that is metabolic disorder due to a high plant-based, low-fat diet, which ultimately is the killer for all of us. We've got it all wrong. Fats are not the deadly cause of disease. Carbohydrates and sugar are, plus all the plant phytochemicals and antigens that are really the killers. We found a internal cyst, internal cyst in my pituitary gland and have hyperlactin. Will I still be able to do IVF? Yes, you can. That's where evaluating the pituitary, CT, MRI, if it's a high prolactin, treating it with Dostinex or Parladel may be important, but really making sure you're supporting the luteal phase and making sure the progesterone levels are adequate, by the way. Alyssa, how you doing? Radiance, hello. Operation Baby Maria, hi. Bilateral hydro, would tying them help or removing them? I usually recommend a laparoscopic or a mini lap removal of the tubes or ligation of the tubes if you can't remove them. Rarely have I ever had to do a laparotomy. It's a laparoscopic, either ligation or removal of the whole tube, because if you leave the tube that's hydro, it may still contain a tremendous amount of local inflammation and it may affect the ovaries, tubes, and uterus, or systemically. Remember, an abscess is not a good thing for our body. You need to get rid of it. It might be a 1 to 3 months of antibiotic, antifungal, antiviral. Remember, we're just a culture dish. That's all. All other macroorganisms want to live off us as we want to live off them. We're all in this journey and cycle of creativity in life. And remember, we're just energy for something else, and they're energy for us, all of us. But I would remove those prior to a transfer at least. But there are some people that actually succeed without removing a hydro, one or two. And there are likely many women that have one hydro, a normal tube, and get pregnant to deliver a baby, and it's not really a big issue. So just recognize that the answers are not straightforward. Don't forget, I'm going live at 11:30 today with Monica Beavis, Facebook support group, the IVF Journey. But remember, it's a fertility journey. And don't forget also to check out Fertile Hope Yoga with Erin McCullough. And nowadays, and Marley is doing it, where we can all do a Zoom connection from wherever you are in this world. It's almost easier that we do it this way. We don't have to get in a car and burn more fossil fuel. We can do some rest and relaxation no matter where you're at. And remember, wherever you're at, you can just take the moment to take a breath and smile and recognize that God has given you life. And when we slow it down and cool it down, the blood flows better through every single organ of our body, and reproduction builds even better. Hopefully, okay, chime in. Let's see. Less than 3. I don't know where that one came from. Chai, sorry. Alana, how much can a hydroscopics affect the overall outcome? We think there's about a 25% or 50% reduction in the success by leaving a hydro, by the way. We'll be working with Dr. Mags, yes, when it opens, July. We just have some transitioning things. My team's going to get a little overwhelmed, so we have to be patient in the process, in the progress of life, by the way. Chris and Martinez, again, less than 3. I'm looking back. Is there an age limit? Can women who's never been pregnant be a gestational carrier? I do say yes. Lola, pars intimacy. We talked about that. Let's scoot over to the Instagram. It's being a little slow for some reason. I'm trying to get it moving, but add-ons to help after a chemical pregnancy. MZ Willow, how are you guys doing? Much love and gratitude that everyone's sharing, by the way. But the add-ons, again, go to our website, go to the patient portal, cmyfertility.com, and check, look at the resources and the simple guide, which is, again, what you change in here and in here really matters. But embryo glue, PRP HCG washes, the antihistamine protocol, Lovenox, aspirin, Plaquenil, prednisone, Neupogen, and then the IVIG, Humira, all of these things. But Kiltz and Emmerich Keto is a home run. Check out the Fertile Feast on Amazon. But sometimes it's overwhelming and it's way too much for all of us. All of us feel it sometimes. So what can we do to do less is best in the journey, by the way. And sometimes when we let it go, it just happens. That's the miracle and mystery of the universe. Versus Clomid for low testosterone. So I think, let's see, Fari Sak 92, I think that Clomid 25, sometimes Letrozole 2.5 and HCG 250 a day can be really helpful for guys. And don't forget LDN, CBD, and Kiltz's keto, and get them off the treadmill, cool the testicles down. Too much heat, too much exercise, that can really help the sperm increase. Now, for some people, these protocols actually diminish the sperm, diminish the egg, but why it does, boy, that's the miracle mystery we don't really understand, by the way. Let's see, when you start the IVF cycle, how long does it take normally for them to retrieve the eggs? On average, it's 10 days of stimulation, a trigger shot, 34 to 36 hours later is a retrieval, and then anywhere between 2 and 7 days later is a transfer. On average, day 3, day 5 after retrieval. If a freeze-all, the next month, and in some cases we do a duo stim or a triple stim where you do a retrieval and then a week later start your stims again and then about 2 weeks later, another retrieval. A week later, start another stim. 2 weeks later, another retrieval. So you can do serial banking, and that builds the blood flow and seems to build the energy of the ovary and the follicles. Mini protocols, letrozole or Clomid, plus 200 of gonadotropins, plus 20 of HCG, maybe 6 of human growth hormone, with an antagonist HCG and or lupron trigger can be very helpful. If you have a low AMH, you don't need the high dose. If you have a high AMH, you want to do the low dose. So again, we're looking and trying to find the thing that works best for you, but we don't always hit the mark. We have to adjust it depending on, again, when we shoot the arrow and it misses the mark, we've got to then adjust it all. And don't forget, we're all learning on this journey. It's all very imperfect. Letrozole trigger for a couple IUIs with no success. Add-ons. Unitel. So basically, look at IVF add-ons. They're good for IUI add-ons. They're good for intercourse add-ons. It's really the same process for no matter what you do. Don't forget laparoscopy, hysteroscopy. 2 to 4 weeks of antifungal, antiviral, antibacterial approach, LDN, CBD, and then the immune protocols. But number one, Kiltz's keto plan. Mind and mouth masters what goes on in the core of our bodies, and it helps tremendously. But sometimes, depending on your age and AMH, we might add a little bit of the low-dose gonadotropins to the letrozole Clomid with a trigger shot, combined with Intra Lipids, Lovenox, Plaquenil, antihistamine protocol, all of these together, by the way. And I generally, MZ Willow, do you stay on the aspirin with a positive test? It depends. If you know we have a lot of inflammation, repetitive losses, stay on it. For some reason, for some, we believe there might be a little bit of increased subchorionic hematomas. We recommend backing off, might add the Lovenox, but if you're bleeding in this, well, then we'll back off on that, and then we'll re-add it in week 2 or 3, by the way. But most of all, stay Kiltz's keto. Ketogenic diet ideas are sustainable for life, by the way. It's the anti-inflammatory, kick-ass, most amazing thing I've ever learned in life. At 64, 1 meal a day at night, typically, occasionally I'll have some popcorn with butter, or I'll have some French fries dipped in mayonnaise after being cooked in duck grease. But again, reward yourself, but remember, you don't want to cheat. You want to take care of the Ferrari. Remember, the lioness and the lion, that's what we are. And don't give up. But the more you just step back and listen to new and different ideas, I too, in my 40s, begin to look at ideas that I didn't believe as a data-driven craziness. I realized that so much statistics and data is doo-doo. We need to look at opposite approaches, and I've been amazed at how they work, by the way. How can us past blood clotters keep safe during retrieval? Alicia, so blood clotters, well, again, sometimes we're using aspirin or Lovenox pre-retrieval, post-retrieval, or heparin in some cases. Some cases we have people that actually have on Willebrands, and that's where we may need things like DDAVP. I really believe that a lot of it is caused by a high plant-based variety diet, which is not good for our system. And bleeding abnormalities, MTHFR, bleeding problems are very common due to a high inflammatory environment that affects the platelets and the inflammatory, the blood clotting cascade, which I think is a very, very big factor, by the way. Cruz 40, how you doing? All right, awesome. And remember, trust the process. This is our challenge, is trusting the process, having faith in the master creator for all of us. We're all really driven by that same energy that's creating all of us. When we can all recognize, no matter your size, shape, color, age, faith, beliefs, we all are children of God. We all need to learn to treat each other like our brothers and sisters and recognize that. We need to do better every day on how we take care of ourselves, our family, our friends, our foes. We are learning constantly. Let's all recognize that every single day. Transfer 2 embryos with the donor eggs, possibly. So I can't automatically say yes to everyone, but we'll look at it individualized in the process. Yes, we do conscious sedation, IV sedation for an egg retrieval, a hysteroscopy, DNC, or a DN. So we do that in general in our Syracuse and Albany. We'll be doing that in Buffalo and in Colorado to come. So really excited with Dr. Magarelli. Failed IUI cycle to be over. How quickly can I move to IVF? Generally, you can move pretty quickly. That said, my IVF embryologists are rocking and rolling, or surgery people. So we have to make sure that we're able to take care of everyone in the most global and the best approach. Sometimes we might say, you know what, we're gonna start you in a few days or a week. We could start you today, or you know what, we want to get a little bit more evidence, or we want you to do some things that will really improve the environment of the Ferrari, the Lioness, and the Lion King. And by improving what's in here, we'll improve what we get out of you so that we can create and put back in you in the best way. See you in about 2 weeks. CHDZ, Medrano, how are you doing? Shay, how are you? It was really great seeing everyone. And sometimes, remember, I'm going from one place to another. Dr. Corley's doing retrieval, Dr. Lutheran, I'm doing transfers. We're all mixing up. Dr. Chang, Dr. Grossman, Dr. Ditkoff. We're all working to be there every day for all of you. But sometimes I too need to make sure I'm getting my rest, my naps, my meditation, my prayers, listening and learning. I've been reading again a book by Yuval Noah Harari, The Sapiens, A Brief History of Humankind. It's really amazing stories. Remember, there's stories that build our learning and understanding of everything in life. Cowboy Nation, how you doing? My wife and I started keto this week. I know you recommend intermittent fasting. I call it intermittent feasting. It is hard to start that. You can do your supplements at night with that, but if you want to have a little bit of a snack because you're learning the journey, you got to start it what works for you to start it. But there is a menu and a plan. We are a human being, binocular vision, stand up erect, hunter-gatherers. We are not four-legged grazing animals. So my general sense is when you can do fertile feasting, that's intermittent feasting. It's one meal a day. That's the very best way to feed the Ferrari. It does help a lot. But, again, we're all practicing a new and different way. It took me a while to figure it out. My body was fighting me. It still fights me a little bit. If there's food around, I want to eat it too. I love the top of a pizza. My embryology team loves the burnt dairy breakfast pizza, but I love the original Pizza Kitchen, OPK, I think it is, the top of the pepperoni and cheese. That's all I get, a little bit of a snack from time to time. But I have to make sure that I really work at only eating one time a day in general. That makes this body the very most running, smooth Ferrari. Okay, so Operation Baby Maria with bilohydrous toppings would tying them help remove them altogether. I mentioned remove or tying. One of the two I think helps. God bless Sam. God bless you guys. Hello, hello, hello. J.S. Yajari Era, good morning. Anitra, good morning. Love to you guys. Christian Martinez. And I'm getting these text messages. Some days I get, like on Saturday or Friday at 50. I can only do my very best. I know I throw it out to everyone. If it's an emergency, you need to talk to someone, and you're not getting able to go to the emergency room. Listen, we're all doing our very best, and we're so grateful to everyone. We're all doing our very best. What am I going to say? Right? All right. God bless you guys. Nurse Carly, gratitude to my global team, my in-house team, the outhouse team. I know it seems a little crass, but we all need to remember it's all fertilizer. Success with IVF with motile sperm count at single digits. Yes, you can. Mostly with IVF, but IUI, I've seen it, by the way. All right, Kelly, Garakis. What do you do baselines? Okay, so now here's our confusion over baselines. And I've been chit-chatting with my team on how to make it more efficient for everyone. I'm often talking about starting your meds on day 1, 2, or 3 of the cycle, even a baseline day 2, 3, 4, or 5. But sometimes it might be do a home pregnancy test, start your meds, get a baseline after that. Sometimes you might have started your meds and recognize, we got to cancel. But sometimes the baseline is strictly, what does it look like now? So we know what it's going to look like in 5 to 7 days. But in general, day 2, 3, or 4 for your baseline. Start your meds for either intercourse, IUI, IVF, an egg retrieval, freeze all eggs, or make embryos and freeze them or transfer them. We have so many different approaches. It sometimes can be really confusing, and we want to pull out our hair. Yeah, I know. I've been doing my own lately, and actually for a long time. Sometimes you go do a little too short. Miss T, it likes it a little longer, but this is easier to care for me anyway. But again, baselines usually do day 2, 3, or 4, but we're getting so many baselines, and I don't like to wait. Sometimes you get your baseline even before you start your cycle, or when you're on the birth control pill, or you are on Lupron estrogen or human growth hormone estrogen. Then we can know where you're at, stop your meds, or just start your stims. But there's lots of different ways to do it, by the way. Fertile Feast and Daily Inspiration, Amazon, trying to implement keto, positive mindset, Angela DePetta, since I have time for an FET in August. It's all about the mindset. Always start the day with thank you, God, for this day. Spirit, nature, gratitude, attitude. That's the way to drive the master, which you are the master. It's within each and every one of us, no matter who you are. Remember, how many of us have been living with worry, fear, regret, and judgment? We do it out there, but we're doing it within. You've got to take the reins, and remember, you're the driver and the director. You might have multiple GPS options. Pick one, do one. Listen and learn. And I'm going to make sure all of those are on Audible. Because I'm an Audible guy. I love doing my pottery and painting at the same time that are listening to the story. Or sometimes I'm doing a live and sharing thoughts and ideas how we can all improve every day. And if you can imagine, whatever's happened to you in life is the very best. No matter what it was, God gave you a treasure chest of opportunities to learn and grow. That's the trick. It's very difficult for all of us, by the way. So check out through Amazon.com, the Fertile Feast, the inspirational books, and the Fertile Secret, and the new Dr. Kiltz's Keto Lifestyle Plan. Remember, I'm all for vegans, vegetarians, Mediterraneans, ketarians, pescatarians, and paleotarians. We're all learning together, and the first thing we must master is our minds. Pretty nurse, hope to start stimming soon, around 5. Do baselines first. Not always, but we're working on that. Sometimes it's, especially with the Clomid, letrozole, trigger intercourse cycles, it might be, or IUI, start day 2 to 3 of the cycle. We give you a full plan, ultrasound, blood work, but remember, you got to do a pregnancy test at home at least in the process. 43, remember, 43 years young, always vision. And if you check out, again, let me get back to Brother Ray's Roseanne Austin, and check out her book, The Fertility Mindset. It's a home run. We're all working together, all of us, and the more we can do that, the sit-ins and the protests are really there to help us all change our minds and see something different and better for everyone. We all need to keep doing that and don't stop in the process. We're just saying, hey, we're all one. We all have to do it better and find love in the journey. Silvana, get the perfect timing for natural IUI. Well, remember, the more sex you have, the more opportunities getting sperm into the right place or doing an IUI, natural cycle, but it may be an ultrasound, a trigger shot, or it may be home ovulation predictor kits. And then it says, okay, I'm ovulating tomorrow. I'm going to come in or do a home IUI or intercourse or whatever in the process. Thanks everyone for joining in this and sharing the concepts and ideas and teaching me. So much of what I'm learning is from you guys, by the way. And let's see, TikTok. I may need to listen and learn about how to share some ideas a little bit more on YouTube. Check out our YouTube channel. But remember, Instagram and Facebook is a good way to learn together. Endometrium causing bleeding in early pregnancy. It happened to me. Yes, I think these vaginal inserts can cause inflammation. So sometimes it's either oral prometrium, it's intramuscular, or it's just, hey, I'm really checking my numbers. I'm doing more natural methods of meditation, yoga, prayer, massage, acupuncture that may boost my natural production. Hey, Meg, how you doing? Thanks to Meg, my nurse practitioner team, all my nursing clinical team, my all levels, we're all working together to master this journey. But remember, when things don't feel right, it's still right. It's still sort of saying, okay, I'm hurting. This is painful. It's very emotional. The epinephrine and cortisol is really heavy and high. Take a breath and hold the smile and know this, that you are part of the journey of the universe and God is within all of us. Do not let it go ever, 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 by the way. So I stop omnitrope between a duostem and third cycle. You don't have to actually stop the omnitrope. Sometimes you might continue it. But there are some people that I think may not benefit from the omnitrope. Some things might be more harmful, but we don't always know that. Oh, a shout out to Dr. Faruqi in Montreal. Gratitude to the Canadian team and all the Canadian doctors that are helping all of us approach a more global integrative method that we can help on natural fertility at any and every age, that we each can work it together to make it work. Remember, if you're feeling the pain, it's somehow helping you drive and look to the light to find the success that is there for all of us, by the way. First, find out gender of your baby. So you can do a serum blood test at about 8 weeks, but it might be an amnio CVS, but you might also do PGS and identify it well before you even did the conception. But in general, about 8 to 10 weeks with the serum test, and about 12 to 18 weeks on an ultrasound. But it varies depending on what you see in this. Chris Ann Martinez, Jennifer Ham, caffeine. Caffeine is a drug. I'm slightly addicted to it. I know that. But 1 to 2 cups a day, there are caffeine in lots of things, so you have to be careful. All right, 11:30 today. All right, I'm going to be on the live, mostly talking about support. The mind is the master of the universe. And check out James Allen. And if you haven't read the Bhagavad Gita, the Quran, the New and Old Testaments, or simply finding some philosophy that'll help you each and every day, I'll see you guys at 11:30 with Monica Beavis, Facebook support, the IVF journey. And on Monday, I'll likely be there, but I may take some time off later in the week. God bless to everyone. Thank you for joining. Buffalo, probably September. We'll only stay there. The COVID kind of helped things up, but we're getting our lines in, gas lines in, gas stuff. Everything's coming. Hydrocell banks removed. Can I start right away to start IVF? All right. I'll see you guys. I love you guys. Thank you very much for joining me. God bless. God bless you guys. And share it. Cheryl, talk soon. God bless you guys. Ginger and bye.